went ahead and like grabbed the back of his shirt, real cute, and riding our bikes, like so he could tow me. Before I knew it, his front pedal went into my front tire. So it immediately stopped my bike and I catapulted forward. So I had the crossbar. So my pelvis hit the front and I flipped over and I immediately knew that I sliced myself in half. So I hit my head. I was in shock. I was passing out left and right. I couldn't move. Called the ambulance.
Well, welcome back.
Yeah.
Nice change of clothes,
I
like
know,
mid thing. It's like it's like a concert.
Take two.
No, it's like I always watch like Lady Gaga. Like she'll change like 15 times, like in one concert. It's pretty wild. So listen, you love taking care of your patients, and you have patients all over the country, and you're doing stuff, and you vibe with them, and you connect, and you listen to them. But you yourself had an unfortunate, trauma of your own. And it's interesting when the provider becomes the patient. Talk a little bit about that and how that shaped the way that you then relate to other people, the way you treat. Did it change the way you treat people, or your just kind of mindset about the whole situation?
Yeah. So I think we're on autopilot. We go through a lot of schooling. And you went through residency, and then after that, it was like hit the ground running, right? So you never get to take a deep breath and to really evaluate your quality of life. So I was in that headspace, and I was working, and I was cranking out patients, and getting fatigued and tired, but this is what I love to do. Until God said, we're gonna like put a halt. The universe, whatever it was. Because there was something else out there for me. And I always knew that I wanted to be an entrepreneur and reach more patients than just what I was allowed, the 10 minutes at a time. So on the side of working my normal job that I was in and hustling and seeing patients, I became the national provider speaker for Eli Lilly Pharmaceuticals with their GLP-1. So I was doing that on the side. I was just hustling, and I had my little telehealth practice. This is before COVID. And then COVID, just started into play. Well, I was dating my husband for only 6 weeks. So we weren't married yet. We were dating for only 6 weeks. And I thought I was going to be really cute and flirty. We're riding bikes, so we're cycling. We work out a lot and everything. And so I went ahead and like grabbed the back of his shirt, real cute, and riding our bikes, like so he could tow me. Before I knew it, his front pedal went into my front tire. So it immediately stopped my bike and I catapulted forward. So I had the crossbar. So my pelvis hit the front and I flipped over, and I immediately knew that I sliced myself in half. So I hit my head. I was in shock. I was passing out left and right. I couldn't move. Called the ambulance, and I had a suprapubic open fracture. So just imagine my labia just sliced wide open, whoosh, and the bone sticking out. So, tell me how bad of a trauma, that's going to be.
That's a serious trauma. I mean, pelvic trauma is very serious. In fact, if it's serious enough, I mean, you can literally lose liters, of blood, into your pelvis. I actually did all my trauma stuff during residency down at Tampa General Hospital, and there was a lot of pelvic fractures coming, and it's horrible. It's one of the worst, and it can lead to it's a very well-known fact that pelvic fractures can lead to chronic pain, like forever.
Well, so again, only dating my husband for 6 weeks. So here we are. I'm being rushed to the trauma center. I had to have emergency surgery. But the funny thing was, when I came out of surgery, and my husband now, he has a video of it, and I'm laughing, and there was almost a relief that came over me. I was just so happy to have a break. Something had to shut me down.
You sure it wasn't the meds?
No, well, I mean, that was, but no, you can see I wasn't, and I'll even like send a little clip of it. I wasn't loopy or anything like that. I was just, it was like, okay, I have everything set in place. You know, we had talked to Jess Silva earlier about making sure that you have all your estates, your wills, all this stuff in place, and you have disability insurance. And I had set myself up pretty, so I was like, okay, I'll be okay. It took me 3 months to learn. I had a walker, like to learn to walk again. I had to go to physical therapy. I put myself in the patient's, mindset position and thought, okay, if I'm going to tell my patients that they have to get up and walk and they have to do this, I have to do it. Right. And I was swole. I mean, this is TMI, but my labia looked like a testicle. It was horrible. And with the blood all down my leg. Now, this is what I faced that a lot of people out there face, and it's the continuity of care falls out from under us. So that surgeon, that trauma surgeon, that orthopedic surgeon that took care of me that day, he resigned 2 days later. So I was supposed to have a follow-up appointment, and it got pushed out. I had all these sutures in me.
Wow.
It was pretty bad. So I followed up with one of his colleagues, and he saw me. He's like, okay, come back, so on and so forth. So I couldn't get in. So I'm 14 days out, and I have these sutures in my labia. So what did I do? Got a mirror.
I mean, you are a provider, so I guess you can do it.
I know, but I went and but I thought to myself, what would the layman do? What would somebody do if they're not in the medical field and they don't have access, right? Like where do you go? How do you navigate? So I, thank God, have my community, and I was able to get in with another orthopedic surgeon and made sure the group and so on and so forth. But it made me realize the shortcomings that we have in our healthcare. And that's when I decided, I'm like, that's it. That's it. I never went back to my full-time 40, which is really, like we both know, 80 an hour week job. That's when I decided to go 100% with career telehealth and wellness and say, okay. And then that's when I got into peptides too, like really took off. So I knew about the GLP-1s and stuff, but I'm like, I need to optimize my body. I need to take care of it. Like this, God gave this to me. I need to preserve it. I need to start like, let's wise up and see. And what else can I do alternatively? Because like you said, I don't want to be taking any medicines, and I wanted to fight, and I wanted to be strong. And there was nobody else was going to be out there to save me.
You got to save yourself.
Right.
Mel Robbins constantly, would she say the same thing?
Yes.
She's like, no one's coming. No one's coming to tell you to get up.
Right.
No one's coming to tell you to go to the gym. No one's coming.
She had the 5-second theory, right? Just
oh yeah, the
5 seconds.
5, 4, 3, 2, 1.
Yes.
NASA.
Yeah.
It's the NASA rule.
I love her.
Yeah.
We're giving plugs for her.
We're giving
right now.
plugs.
Yeah.
Mel.
Yeah.
Mel, make sure you put me on your podcast.
Yes.
Your people are pushing
theory.
me off for too long.
I have that book right on my
Yeah.
coffee table. I listen to her podcast all the time, but it's true. There's nobody that's so. What I want people to understand is that we're going to give them the platform. You're going to give them the platform. I'm going to give them platform to be able to be the CEO of their health, but they have to take the initiative. Like we can offer it all day long.
You can bring a horse to water.
You can't make them drink.
There you go.
Yeah. I used to think, I'm the most motivated and I'll go to the gym. Motivation dies, bud. It just does.
Motivate just means to give people a reason, to give people a motive. That's all it means. We've turned it into something else. I mean, do you know how many days I wake up and I'm like, yeah.
Right.
No, you just do it. It's called discipline. It's called non-negotiable.
Right.
It's called, when your shoulds become, your musts. It's all that stuff. People have heard this stuff before, but it's just truth.
My kids are the ones I think that taught me and grounded me in life in regards to if they're throwing up and I'm throwing up, Doesn't matter if I'm throwing up. I got to get up and take care of them and clean up the throat.
Amen.
So
that's what moms do.
Yeah. That's what
Dads,
parents do.
Sometimes.
Yeah.
It just depends. We're more babies. We're like, I'm really sick. I feel terrible.
I know.
I'm going to lay down here. I know you're throwing up too, but why don't you go take care of the kids?
But the thing is that it teaches you that sacrifice, and you know you have to do it. So even now that my kids are grown, I still implement that. And I'm like, okay, I still have that same mindset and that same, strategy that I try and share with my own kids. Listen, nobody else is going to be able to do this for you. You might as well start it early in life, because the seeds you plant now, they are going to grow if they're good or they're bad. So I come across as maybe always telling everybody, you need to get a fire under your butt. You need to get a fire under your butt. But that's only because I had such a severe accident. And if I didn't have some type of foundation under me, I could have lost my house. If I didn't have that disability insurance, if I wasn't already plugging away at different things and having things set in line.
People get just wrecked
right
when this stuff happens. Like literally, I just use lay terms now. I don't even talk. I'm not going to do the doctor thing.
Medical. No,
you're wrecked.
Yes,
if that happens, you're like, honestly, you're done. Stick a fork in it. It's so bad.
Exactly.
You know what happens, to people. And you're a healthcare provider, and you felt lost in the system, and you know how to get around.
So lost.
And that's why I think putting together these strategies to allow people to at least be part of communities where they really are in the know as part of the community, and then they can keep going up in, what their level. Okay. It's just like if you buy like anything, you can buy the basic insurance plan. At least you have insurance.
Right.
If some disaster happens,
right.
At least you have the basic car insurance, right? You might not have all the policy, but then you can go up as high as you want in policy. Once people get into the basic, though, they're like, that forces them to learn about what the other things are.
Exactly.
And then they start going up the ladder. Now you're completely protected. Now you have a medical thing happen. You have a team. You don't just have like your doctor team. You have your consultant. You can go to these people. They're going to manage everything. You're going to call your doctors. They're going to make sure you're in the right hospital. Whatever. They'll get you transferred. They'll bring biohacking into your room, which I have a great story about.
So we give them that foundation. We educate patients and everybody on that. But also they have to understand that I was able to go through physical therapy and really heal pretty quick because I already had that foundation. So it's really important that they optimize their sleep, that they go to the gym. That's great. But also like love your body a little bit.
Just movement. They have to have some, for some people, it's just like walk the stairs, man.
Yes.
Take a walk in nature, do anything.
Sun.
You got to start somewhere. You have to
5 minutes.
you have to crawl and then that kind of stuff. The movement thing and flexibility.
What did I tell you? Stand on one leg, right?
Yeah,
while you're brushing your teeth.
Yeah, well, good luck. I said good luck to most Americans on that one.
Do us a favor, like send us videos of you brushing your teeth on one leg. I really want to see it.
I think that would be good. I think that'd be awesome.
Yeah.
Send those one-legged toothbrushing videos.
Yeah.
I'll send mine. If I fall over, I won't send it.
Yeah. No, you have to send it. We're going to send ours, but match us on that and send us just because that's part of it. So, just like what else? Daily like ADLs, so washing your face, maybe implementing some peptides, maybe it's, take pictures of yourself. And it's not so much aesthetically to say, oh, look how pretty I am, but to see how much you grow.
But over
time.
When you do that, you force yourself. Let's plug somebody else. Let's plug my boy, David Goggins. All right.
Yes.
You know what people don't do? They don't sit with themselves in a quiet room, in a dark room, and take full accountability over their life and where it is. And we are like so dishonest with ourselves. We're probably more dishonest with ourselves that we literally like the amount of people. Listen, do this in an entire day. Just listen to the voice in your head and figure out how many times you're just telling yourself the biggest BS lies in the world. We're really good at that. The only way.
Give me an example.
Oh, that was, that's enough. You don't have to do this today.
Okay.
That was a really hard workout. You know what? My ankle is sore, so I'm not going to run today.
Right.
You know what? I'm a little under the weather, so I think I'm going to call out of work today.
Right.
You know what? I had that project. today's not a good day. I'm just not feeling well. Today I need a rest day.
Yeah.
Well, you know what? A rest day after 8 days of rest?
No,
that doesn't
it's
help.
not going to work.
No, that's you. Before we worry about recovery, why don't we do the workout first? Then we can worry about recovery.
Go.
Everybody's a recovery. Everyone's the recovery, gurus now. You actually have to push yourself to the point where you actually need recovery. Just not doing anything. But anyway, we tell ourselves lies all day long. The excuses are, it's so ridiculous. One of my favorite things to do is when patients make excuses. And the thing, I swear to God, I just called them out. I said, time out. Say that again. Repeat that. What you just said, say it again.
Hold them accountable.
I was like, say that again.
Yeah.
And now listen to it. Imagine I had said what you just said. What would you say to me? Is that like, what do you sound like?
Would you choose another doctor?
And they're like, oh, that sounds idiotic. And then we move on. So I'm saying we gotta stop doing that, but we have to, back to the David Goggins thing, he calls it a live autopsy. He's like, most people have an autopsy of themselves when they're dead. He's like, why don't you do a full autopsy and figure out what is wrong with me? What do I need to do to correct myself? It's that whole thing. No one does this. Take a piece of paper. For those of you watching it, take a piece of paper, put on one side, be honest. Where are you right now? Where are you actually at right now?
Right.
What are your behaviors? What are you doing? And then write another side. And you don't even have to do it. Just write what should you be doing based on what you already know. Because most people know.
Where do you want to be? You have to set a goal.
And then you have a goal.
You have to have a goal.
No, you have to have a goal.
It can't be like,
I'll
get there. This is kind of like my ideas or whatever. And you have to set a date.
But that's why that piece of paper is so critical. If you don't write, you know what? There is a percentage, I forgot. There's actually like some good studies on it.
Give me stats.
There's a stat. I don't know the stat. I just know it's dramatic because when I heard it, I said, that's crazy.
Okay.
When you write stuff down, your goals or what you're going to do or whatever, it changes things dramatically.
It imprints it in your brain.
And if
you read it every morning, it's like telling yourself in the morning, I'm worthy, I'm great, I'm going to be able to get this, and then having a gratitude practice. Right?
I love gratitude practice. All day.
And they say that it reroutes the synapses. Am I correct?
All day.
Yes.
I mean, why don't you just be grateful for what you have, not for the things you want. We spend, so now we're getting into you want to get into the weeds. But I'm just saying, we spend most of our lives either in the past, what happened, or we're planning for the future. There's a moment right now, we're so distracted. We do not want to deal with this moment right now. What happens when you have an uncomfortable thought? You take out your phone, you start scrolling cat videos on TikTok the whole time. 20 minutes later, you forgot what the hell you were thinking about. It's there. You're just suppressing it. It's still there.
Yeah, but you know what? They're not suppressing it because then they come to me and they have quote unquote insomnia and they want meds. Yes. They want meds for that. And I say, you know what your medication is? I want you to keep a notebook on the side of your bed.
Yes.
I want you to write down everything that you're worried about and everything you have to do tomorrow because that's how you're going to go to sleep. You have to unload it from your brain. So that's part of like a therapy technique that I will do with my patients so I can cut down on the polypharmacy. So it's, like you said, holding them accountable and being like, why are you at where you're at? Let's look at your actions and see what we can do now to alleviate having to think about taking medications or, oh my goodness, I'm depressed. I'm not going to be able to get through my day. A lot of these
medications, by the way, that people take when it comes to like some of the, like the benzos and, some of these psychiatric medications, it's just so they don't have to, it's just so they don't have to deal. It's just literally so they don't have to deal.
Yeah.
And unfortunately, in midlife, I see this so much. I mean, people are like literally gorked out. I'm like, how do you even go to work on this, on these meds? And a lot of it's because they don't have to deal. It's a very complex interplay when it comes to lifestyle medicine between your nutrition, your exercise movement, your spiritual health, your mental health. There's all these things. Then you have to focus on those buckets. Then you put the biohacking, the stem cell therapies, all these other things on top. There are ways to do this. This isn't rocket science. If you can't do it on your own, find people like Danielle that can help to guide you through this process. Join communities that are, that are out there or ones that are about to be launched.
Right.
And you are going to make a huge impact because if you join these communities, you're going to notice everybody in there is trying to better themselves, and you're always going to pick up tips and pointers. You're going to be inspired. You're going to just be able to take yourself, to a different level. Might there be a community coming down the pipeline that you know about, and maybe tell us what it might be called?
It might be called Above Genetics.
Above Genetics. I like that name.
Above Genetics. So epigenetics means above genetics. So I thought, well, that would be a really good name. I think that would be great. And using your credentials, let's put them to use. So something as simple as everybody, for example, are on the GLP-1s, right?
Right.
And they're losing all this weight. But what's going on with their bones and their muscle mass? And who better to tell them that they need to do strength against resistance, and what type of exercises and why, and the osteocalcin and how, like the bones, and how important it is for the brain.
It's so important. Muscle mass and VO2 max, the number 2 predictors, of longevity. When you talk about the GLP-1s and losing muscle mass, there are so many things to do. You can people on forteotropin. There's something that we use, MYOSMD, which is basically a myostatin, block, so it prevents your muscle from breaking down. It's really important. We use something called the Neuro 20 suit, which can actually build back your muscles, 42 different muscles, that are stimulated.
Tell me about ARA 290.
Oh, ARA 290 ARA 290 is incredible, because ARA 290, in this situation of people having any kind of nerve damage or anything like that, there is a specific receptor on nerve cells that actually only is presented in the setting of nerve injury, and that is what receives ARA 290. So there's so many different things we can do, either for muscle mass, for bone health, for people that have chronic nerve pain, there are so many solutions that I had no clue about several years ago,
right,
that I have now made myself an expert. I mean, we are healthcare providers. We've learned all this stuff before. At some point, we unlearned it, because we were, sucked into a very corporatized system, which is not really interested in keeping people healthy and well.
Right.
They're more interested in keeping people coming back to the well. And again, unfortunately, the providers are caught in this horrible doom loop, and they just don't know what's going on. And to be honest with you,
I want to reach out to them too and let them know that there's
we're going to be doing
options,
huge training for these folks.
Yeah, opportunities, and what they can also offer their patients.
Yeah, and it's not because
and themselves.
It's not because, but again, I always say to people, anytime I talk to any kind of provider, and I could tell they have an attitude. First of all, why do you have an attitude? I'm trying to help you. It's not, and I say right away, I'm not smarter than it's not like I'm not the smartest doctor, that's not what I'm here for. But number one, what I am is somebody that can see things, has an open mind, has seen things, has had an epiphany, has already paid the dummy tax. And I say the dummy tax because I've prevented people from getting great care because I wasn't educated on it. Right. Now I am, so I'm trying to help other people get educated on it. So don't have an attitude when we're trying to help you guys to be better providers, for the love of God.
So I think it makes them nervous too. So a lot of them, just like a primary care doctor, they'll refer them out to a specialist because they don't know, that's not their specialty, and they don't know what they're doing. And then a specialist will say, well, I don't deal with that, or I can't do that, or
it's such a broken system.
It's so sad.
But with whole body healing, techniques. Mm-hmm. And again, we get people like, oh, holistic wellness. They get upset about these words. It's true. Our species has been around for 300,000 years. Our repair mechanisms are remarkable. I mean, literally remarkable.
Guess what, guys? It's coming. Peptides are coming.
The peptides, stem cells.
Yes.
Using all these things, it's remarkable.
Medicine.
We are stimulating our own bodies to heal ourselves, instead of having more. Now, yes, I don't want to use the word exogenous because I guess it's coming from the outside, and a lot of the peptides are synthetic. That's not the point. The point is it's stimulating, for example, the pituitary axis to do what it's going to do, or
but
whichever
that's like
thing.
Insulin.
It's totally different.
But everybody depends on.
Do you know how many people have been saved by insulin? Remember, back in the day, 13 and 14-year-old kids would die from diabetes. Yeah. That was normal.
Yeah.
And then insulin, changed it all. Here's the deal. We can go on and on.
Yes.
I'm very excited about the release of Above Genetics. It's really going to give people an amazing platform and a community they can go to and then go as high as they want. But at the basic level, they can just join a community where they can learn. There's weekly, there's going to be weekly conferences and webinars, and they're going to be able to talk. Speakers, they're going to be able to talk to their, other people suffering from the same things in those communities. It's like, hey, I have MS. What are you doing about it? Like, what treatments are you using?
Right. So
it's
smart.
a great, instead of just random. Right now, it's a sea of randomness. They're using influencers. They're using all this other stuff. I think it's time for a better way. And I think people just need to invest, in their own care. And the first thing they need to do is educate themselves.
Be the CEO of your health. So that's what we're going for. Yeah?
We're going to definitely do that. It's
Above Genetics. You want to shake on
above.
it? Above Genetics.
Let's do this. All right, guys. Thanks for joining us on another episode of Wellness at the Speed of Light. This has been an amazing episode with Danielle Carrera. Look out for Above Genetics coming soon. It is one of the most unique online communities in the world to be the CEO of your own health. We'll see you guys next time.
Bye.
Stay well. Take care of your families. And just being okay or not being okay, both of those are not okay. Let's go for superb. And it is absolutely doable. We'll see you next time.
Bye.